Welcome to the Harpreet Singh Show. I'm your host Harpreet Singh from Surrey, British Columbia, Canada. In today's program, we will be talking to two experts in the field of spirituality and wellness, and my guests today will be Dr.Suman Kollipara and Arvindam Ravindram. So basically, as we know that CINI conference has just concluded, and we have tried to collaborate with CINI as to the expert advice, the knowledge, the wisdom of these speakers need to be brought forward to the local people also around the world. So we will be in the coming days getting all the experts who participated in the CINI conference to come and talk and share their experiences on the topics on which they spoke at the conference. So today we would like to welcome both our guests, Dr. Suman Kollipara and Arvindam Ravindram. Welcome to the program, both of you.
Thank you.
Thank you, Harpreet.
Thank you very much. Thanks for your time. So Dr. Suman, we would like to start with you today, and just a short bio I would like to give about Dr. Suman. Dr. Suman Kollipara is a co-founder of the non-profit Peace for Tree Innovation Society, Center for Wellness and Oneness, that conducts workshops all around the world for grassroots transformation of wellness using tools of ancient wisdom and modern science. He comes with a unique background of veterinary medicine, computer science, and training in Sookshma self-compassion meditation under a rare ancient master, Sunita. So today we will be learning from him on the topic as to what he spoke in the conference on wellness from within. So how can we bring that wellness from within? Because we are very happy with the material acquisitions that we are having today. But despite everything, still there is something which is missing from inside. So let's hear from Dr. Suman Kollipara on how we can achieve this wellness from within. Dr. Suman.
Thank you very much. Harpreet ji. I would also like to thank Dr. Arun Garg and the CINI conference for an absolutely phenomenal conglomeration of the global health professionals. I've been very fortunate to attend that conference 4 years back in 2017, obviously in person. It was an absolutely amazing conglomeration in person. Unfortunately, because of the circumstances, we are meeting over the internet this year. But yet, kudos to Dr. Arun Garg and CINI team for actually making this happen in spite of all the challenges. Again, bringing all the global health professionals onto a platform where we are able to share some amazing insights, both in terms of wellness, medical science, innovation, technology, public health, you name it. It covers the length, breadth, and depth of the wellness. Today, I would like to share some of the insights I had given in the conference. And the topic I chose to speak is wellness from within. And interestingly, 2017, I've also been fortunate to present the same topic at the World Health Organization in the United Nations in Geneva, Switzerland, in the presence of global health leaders. And it was an absolutely inspiring meeting where we had an opportunity to share this sustainable model of wellness. So to define wellness from within in one line, it is a conscience and consciousness-based approach. It might sound a little bit complex, but I'll break it down. Conscience and consciousness-based approach. Conscience, we all know, is the inner voice that we all have. That inner voice which helps us to do the right thing. And unfortunately, most of the illness that we see today is based on the choices that we make. Most of these are called lifestyle diseases or non-communicable diseases, which are resulting in chronic illness like diabetes, hypertension, mental illness, anxiety, and many other autoimmune disorders are all under this category of non-communicable diseases. And the root cause obviously is the choice making, the lifestyle, and our conscience plays a very critical role in that. So once we empower that conscience, literally awaken that conscience, then we are obviously able to make better choices. But because of the rat race of the life that we live in, we are literally, most of us have suppressed that inner voice, that conscience, and making very random choices in a very indiscriminate way, leading to all the health problems, most of the health problems that we see in the world today. And now the consciousness-based approach. What is consciousness? Consciousness is that underlying force, that life energy that is the root of everything. In fact, that is where most of the illness is rooted. When the consciousness is polluted, because consciousness is responsible for our mind, body, and wellness and the physical presence in the world, the root cause of most of these illnesses is lying in that consciousness. So if we are able to change the life energy, the life source, which forms the foundation of health, then obviously we attain the perfect wellness that we are looking for. So that is why the power is now taken back to the people, into the hands of the people, where, of course, in the past few decades, we have seen phenomenal innovation in medical science and wellness and health. But also, there is also a shift that we have been seeing in the past decade or so, where wellness has actually moved from hospitals to homes to workplaces. It has moved from like operation theaters to even airports, where we have like yoga, meditation lounges, where people can actually take charge of their wellness. So this wellness from within model is a very personalized model where wellness is actually democratized, and where we are actually embracing many integrative approaches like Ayurveda, naturopathy, homeopathy, and even simple home remedies, which we have been used to from most of the ancient cultures in the world, where we can take charge of our health by practicing simple things. Obviously, the foundation being that inner conscience and tuning into that consciousness, which is our root. Unfortunately, we are also going through a severe pandemic today across the globe, where the world is pretty much standstill and even finding it hard to breathe. On one hand, of course, we have made innovative revolution in wellness, where we have wearables like Fitbits and other wearables which can track our vitals. But on the other hand, now we are literally desperate for even breathing, and where oxygen is delivered in form of cans and bottles. We kind of saw that shift in form of where we have the bottled water. Now I think we are seeing the shift in terms of bottled oxygen. But whatever it is, we are all engulfed in fear and anxiety. And if you look at the human evolution itself, we actually have come very far away from our source. And it's important, I think, to go back to the basics of where we started as humanity. If you look at any single human being, we started in the mother's womb as a single cell zygote. And that single cell zygote multiplies into trillions of cells and creates this body. And this is, I think, the greatest miracle that you can find in this universe, this self-regulated, self-functioning phenomena. And not only trillions of cells, it is not just the human cells, but there's a bundle of human cells with microorganisms. In fact, the research says that we have 10 times cells of the microorganisms in the body more than the human cells. So we are actually a colony of microorganisms working in a symbiotic state to regulate this without any intervention. You really have to don't do anything to regulate this beautiful system called human body and mind. But unfortunately, in the past few decades, we have embraced a very destructive lifestyle because of the rat race that we are in, leading to a lot of self-inflicted illness, which I mentioned: diabetes, hypertension, anxiety, depression, most of the NCDs, non-communicable disease that we see today. And we may not see it the way we see the pandemic and COVID, which is really killing many people, but the NCDs and mental is also causing similar destruction to the humanity. We are almost at the verge of human extinction. This may sound very kind of exaggerated, but that's where we are at. We are going to get there very soon. And who are to be blamed for this? Us, nobody else. So the goal is to be able to rewrite that story from us. And that's where Peace Tree Innovation Society evolved 14 years back. Obviously, it has been done in an informal way by Master Sunita for 45 years at a grassroots level. And the model is a very sustainable model. The foundation is, how do you build self-awareness and self-regulation into humanity? And we have been doing, obviously, in the past 14 years, a lot of work at the grassroots, targeting the root cause and helping everyone tap into that human conscience. and shifts in collective consciousness. Because at the end of the day, what we need is to be able to shift the individual conscience, individual consciousness, and eventually collective consciousness, and only then we can see a shift in the global well-being. And at the root of this, obviously, is how we feel, how we perceive things in our day-to-day life. And what is involved in this is the mind and emotions. So our program, Peace to Innovation Society, is rooted in an ancient healing system called Sookshma healing meditation. It's not just meditation. There are lots of subtle yogic practices that we do part of this. And this ancient healing meditation obviously works on how we process the information at a mental and emotional level. And what we are seeing is basically bridging this science and wisdom onto a one common platform and seeing lifestyle shifts with this integrative approach. What we realized is one pill cannot cure all. So what we need is an integrated approach where we bring in the ancient wisdom like yoga, meditation, Ayurveda, naturopathy, all of these into a one common platform, which helps individuals. And through this, we obviously have been working on the grassroots. Our educational modalities have been how to impact the psychology and the physiology. And the first thing that comes into mind for everyone is stress. So if you look at most of the NCDs, the stress is at the root for all of these, and the emotional management. Both are the foundation of our well-being. So our focus has been to help liberate this knowledge, which has been kind of niche in the med schools or hospitals, and help a common man, a layman, to understand what is the mind, what is the body, how does the psychology and physiology integrate to create wellness. So we started doing lots of workshops at the grassroots, in libraries, in schools, in community centers, even in addiction centers, prisons, you name it, where we have taken this knowledge through a process called education. Obviously, the three pillars for our organization is enlighten, or you can call it empower. So first step is to help people get that education and knowledge. Once you have that knowledge, the next step is to provide them the experience. How can you experience your optimal wellness? How can you come to that state of equilibrium? So through these sessions, we help people actually experience that mental calm, emotional calm, and see the shifts at the physical level, eventually leading to amazing chronic illness management. And in the past 14 years, I myself have seen amazing shifts in people who have participated in this program. We have seen people heal from diabetes, hypertension, autoimmune disorders, and even mental illness. Like I said, we have taken these programs to across the globe. World Health Organization, UN, Master Sunita has presented these sessions in the Andhra Pradesh State Secretariat in India. Vyasa Swami Vivekananda Yoga University in Bengaluru, National Institute of Yoga in New Delhi, and a lot of conferences where we have shared these insights and where people have benefited in a phenomenal way. Now, if we kind of take a little bit shift towards the science behind this wellness from within, a lot of people obviously say, well, is this all mumbo jumbo? Well, it is not, because if you look at some of the top universities in the world today, they're spending millions of dollars on research on meditation, yoga, and other integrated approaches. And I have been watching thousands of literature, research papers published in this area. And some of the impact of meditation, for example, is in an area called neuroplasticity, where you see changes at your neural network level. The areas where there is stress involvement are seen to be performing lower, and the areas which are responsible for your self-regulation and self-awareness, like your prefrontal cortex, there is higher activity in those areas, higher amount of gray matter in those areas. So with the technology, we're actually able to now see this and say, well, this is not mumbo jumbo anymore. This is actually real. And there are changes even in the gene expression. For example, there is a genetic expression in the body called telomeres. They found that people who have gone for meditation practices see extended length of telomeres, which results in extended longevity. Another simple research that I've come across is breathing exercises. We all know who practice breathing exercises. We have this saliva oozing out from our mouth, and what they found is that saliva that comes out of these breathing practices has nerve growth factors. And
Mm-hmm.
these nerve growth factors are very critical in regulation of your neural networks, in
Right.
proliferation and maintenance of neural networks. Again, a phenomenal benefit in people who are suffering from dementia, Alzheimer's disease. So there is tremendous, I mean, even looking at yoga asanas, for example, at a
Mm-hmm.
physical level, it impacts vagus nerve. Like vagus nerve is the longest nerve that's carried in your body. It regulates your heart rate, your blood pressure, your fight or flight response, your stress response. And what they're finding is there is a phenomenal vagal tone stimulation during the practice of this yoga asanas. And obviously, a shift from what we call the fight or flight sympathetic nervous system to the rest and digest relaxation parasympathetic system.
Mm-hmm.
So the essence of what we are trying to do with this model of wellness from within is bring people back to themselves,
Right.
develop self-compassion, self-love, focusing on you, building the qualities of compassion, empathy, and love for yourself to begin with. And through this process, re-innovate and reinvent ourselves. And it's time. I think, we have focused a lot on innovating and inventing in the external material world,
Mm-hmm.
but we are forgetting the most precious resource. So it's time that we re-innovate ourselves and put wellness back into people's hands.
Mm-hmm.
Obviously, by marrying both experimental, medical science and experiential ancient wisdom. And when we bring these two dimensions, I think we would find that perfect formula, a sustainable model for wellness. Um,
Wonderful.
and
Excellent.
obviously,
Excellent
thank
talk,
you, thank
Dr.
you.
Suman. Thank you for this perspective, what you talked in the CINI conference, and we are carrying that information forward to the thousands of people in the world. Now, you've touched quite a lot of aspects which need to be talked about, but time will not permit me. But I'd like to just kind of sum it up in the sense that how can conferences like CINI help people, especially amalgamating the wisdom of the East and the modern science of the West, when they amalgamate? And as you said, we from the East have a lot of things experiential, and over here we can bring that into practice. So, and especially in this COVID time, because this conference focused on integrative thinking post COVID, what would be your recommendations to general public, how to start and from where to start?
Absolutely. If one thing that COVID has taught all of us is to slow down, take a step back. And I think a lot of people have realized the importance of wellness and self care. I mean, if you look at most of the communication that is coming from public health, as well as from integrated approaches across the globe, it is all about how do you take care of your immune system? How do you take care of your body? How do you manage your stress and emotions? So one thing that COVID has really taught and created a good foundation is to help us build on that. And if we can really take that forward, this aspect of self-reflection, and I'm sure people are, going through a lot of turmoil, losing their very close family members who have succumbed to this and themselves succumbed through the pain and trauma of this. And I'm hoping that this will really ignite a different approach towards the way we live. I think as a humanity, even though we have evolved from animals in the forest, we haven't forgotten that survival of the fittest response. But I think it's time we shift from survival of the fittest to survival of the wisest, as Jonas Salk, the great scientist, doctor who discovered the polio vaccine, says, evolution favors the survival of the wisest. So I think we need to make that shift from the fittest to the wisest going forward, so that everyone is empowered to live a healthy, happy, and harmonious life.
Absolutely wonderful. And of course, conferences like CINI provide an opportunity for the best brains from all over the world to come together, and especially it's been a blessing in disguise. Otherwise, had it been a normal time, it would have been a conference where we would have packed some people in an auditorium, but now this is spreading all over. So once again, thank you very much, Dr. Suman, and I would
Thank
now like to
you. Thank you very
welcome
much.
Mr. Ravindram. He spoke in the conference on the topic of cultivating healthy habits to combat chronic diseases, heartfulness, perspective. And he's a physician specializing in interventional radiology. He works in Fraser Health in BC, has been a meditator for 25 years, and has been a trainer for over 2 decades. He has conducted various seminars and workshops on heartfulness meditation at various forums internationally as well as locally. And currently, he's involved in a research to study the effect of heartfulness meditation in reducing burnout of professionals. So, Arvindamji, we would like to listen to you now. We heard you at the conference, but now you have about 15 to 20 minutes to share your wisdom as to what you would like to tell us on this particular topic.
Thank you, Harpreet ji, and thanks to Dr. Garg and CINS for organizing this wonderful conference where we got to listen to so many experts. And it's a very noble concept where, one of the thematic topics which we need to address and we are still struggling to address is the chronic disease burden. And how do we bring about the integrative approach? And so many beautiful voices and amalgamation of ideas have been presented. Also, we listened to Dr. Suman Kollipara, a dear friend of mine, just talked about a lot of things here. Unfortunately, or fortunately, you're going to hear a lot of repetition here. But, repetition is good. My guru, our teachers have always said repetitions are important and necessary because it's nice to hear some of the suggestions are going to be very similar to what Suman has talked about. And we're going to be needing to have that repetition because we keep going back to some of the old habits, which we all know we do. Now, as a physician and as a coming from science background, I would like to talk about what the background of this. It's nice to know what the problem is. The enormity of the problem. And in the current times, we're going through a pandemic right now. And why it is important to focus on this. And that's why I think CNS and CINI have done a wonderful job in taking up a very thematic topic now. We can say it's a forgotten pandemic or at least an invisible pandemic, the chronic disease burden, in the midst of a visible pandemic we're going through right now. So what is this chronic disease or chronic condition? We can call it like a physical or a mental health problem that lasts more than a year, and it causes functional restrictions or requires ongoing monitoring or treatment. If you think about it, or if you look at it, more than 1 in 2 people in North America have one form of chronic disease or other. Things like hypertension or increased blood pressure, kidney problem, heart diseases, cancer, depression and anxiety, so many other things which form part of the spectrum of what we call as chronic diseases. And why it's important? Because it leads to more and more hospitalization or more care, long-term disability, reduced quality of life, and even death. It's a big burden on our healthcare system, and some of the increased expenditure goes into this chronic diseases. What's also challenging, in making these, in treating these chronic conditions, is that they don't come in isolation. There's always an existing or coexisting form of another disease which happens. In the midst of this, that's the background of this chronic disease, and like I said, it affects approximately 1 in 2 people. And throwing that mix is a pandemic we are going through. It's probably one of those significant events in our lifetime which we are having, and pretty much everyone is affected by this, families, friends, relatives, and we are hearing about so many people dying and affected in one way or other. What have we learned at the global level? One of the things which we have learned is we were completely unprepared for this. Many populations were also left vulnerable because of the high levels of pre-existing chronic conditions. They were not going away during this pandemic. They still had to be taken care of. But these very population have been vulnerable as well. This in turn has led to increased casualty in terms of death. And what the pandemic has also taught us in a personal level, there needs to be precaution. And there's increased focus on prevention is better than the cure aspect as well. Things like social distancing, wearing a mask, or even hand hygiene, all of that is really important because no matter whatever enforcement or regulations take place in the external field, the changes at the individual level ultimately helps to slow down the transmission of the virus or reverse the curve. And like someone pointed out, it's also helped us to slow down and take care of the priorities in life. It's really shaken people to the core. we not only saw the disease being transmitted by air, but something which has been transmitted by more powerful means is like fear, anxiety, by our thoughts even quicker, like how it's affected us, and shaken us to the core. But also it's given us some time, for many of us to pause and think about take stock of the situation, and also, manage our priorities. Coming back to the chronic disease, right? I mean, like the global disease, the global burden of disease study done by Lancet, they mention a lot of these risk factors are actually preventable and treatable, and tackling them, brings about a huge social and economic benefits. If somebody's suffering from chronic disease, it's not just them; their family also has to undergo a lot of suffering, and the society, it's a burden to the society in terms of the healthcare costs as well as the countries. So some of the things which we can do by reducing the risk factors have been put together in the form of eating healthy, getting regular physical activity, getting screened at the appropriate time, and getting enough sleep, making healthy choices at work, school, and community level, and avoiding excessive consumption of alcohol, or decreasing the use, or cessation, or stopping the tobacco use. I mean, what it does mean, or boil down to ultimately, is the fact that we have to create healthy habits. And that's where I feel, in creating these healthy habits, and we are creatures of habit formation, and we can easily be turned or regulated to form healthy habits. And that's where the regulation of mind and regulation of certain components of our body helps in creating or sustaining these healthy habits. That's where I feel the yoga and the yogic techniques and meditation brings a big role in maintaining health or decreasing the burden of chronic illness. The advantages are that these are really simple techniques, and these are time tested. They've been there for millennia, and they are easy to incorporate. It does not require any big investment, but on the other hand, brings enormous health benefit and plays a huge role. And if let's not think it's just related to health alone, because the original idea behind these is consciousness, or elevating our consciousness, like what Suman alluded to earlier on. Some of these are tied to our consciousness, and it's important that we expand our consciousness, and that's where these techniques came into play. But these techniques not just bring in their own inherent advantages, but a lot of health advantages as well. Looking at another way, when we change as individuals, the communities change and the world changes. We bring more harmony, inclusiveness, and create a compassionate world. The pandemic, one of the things has brought about, apart from priorities, it has put an increased focus on social inequality. That's a big issue right now, and that's the biggest problem we are going to be facing. And really speaking, unless we bring change at an individual level, it'll be hard to achieve bridging this equality by just economic or political means. We need to be changing, or we need to be using some of these from an individual level. We have often heard about this statement, in this sequence. It's a 19th century proverb, I think, about the thought leading to good action, or thought leading to action, which in turn leads to habit, which in turn leads to character, and then destiny. By managing or creating good thoughts that can influence our action, which in turn influences our destiny, not just an individual destiny, but collective destiny. So with that goal in mind, Heartfulness has been serving for more than 75 years, and the techniques have been put in place even before that. We exist in about 160 countries with millions of practitioners and more than 10,000 trainers and several thousand volunteers. We have been taking these initiatives forward to these are offered for free. We have free training sessions on yoga and meditation, and we've done this in corporations across the world, communities, hospitals, government organizations, universities, and schools, all taken care of by volunteers, not just by just a single person, by multitude of volunteers. And there are also other forms of community service like free medical centers, food distribution, and now COVID care. I would like to highlight some of these techniques which we use, and which again, Suman beautifully touched on about the benefits of meditation. One of the things which we aim to achieve, or which we use, is by meditation. We use a simple heart-based technique where we bring the focus on the heart region or the heart chakra. The focus and the work in this region encompasses all other chakras and goes beyond that too. The unique feature of heartfulness meditation is this aspect of pranahuti, or what we call as transmission in English. It's the pure vibration from the source which helps us in progressing, in taking us forward, and also transformation. It helps us achieve this deeper states of absorption, or what we call as samadhi, or states like delta wave. If we get connected to EEG, all these states can be achieved effortlessly and even without prior experience of meditation. And we have trainers who can be contacted at the local level or through an app who can give you an experience of this. But it's important to note that meditation has been, as a technique, has been studied vigorously. If you do a literature search, there will be millions of articles upon this. And there has been several proven benefits, which Suman again talked about. I would like to stress again, it plays an immense role in stress reduction. And so many research publications have substantiated this. Why that's important? Because chronic conditions are intrinsically related to stress. A mind that is balanced is at ease, and it's easy to tackle and control, or even combat this chronic conditions, because the stress goes hand in hand with these chronic conditions. There are also several benefits with meditation, like managing our emotions better. More than we think, the emotions play a huge role in decision making, in creating habits. If at all anything, one of the things which we have learned from the pandemic is also that critical thinking does not always work. Emotions play a huge role. Whether it's wearing masks or vaccination, you see the impact of emotions everywhere. Meditation also brings about better focus, better memory, learning, and being more open, less fear and anxiety. And like what Suman was saying, at the cellular level, it affects our chromosomes in a positive way by lengthening our telomeres. So much so, with the meditation, the benefits of meditation, so many medical associations, quite notable ones, have been embracing the concept of meditation. For example, the American Heart Association, they came up with a statement where they looked into meditation in a really elaborate and thorough manner. And one of the statements they gave was this: given the low cost and low risks of this intervention, I'm going to underline that again, the low cost and low risks of this intervention, because the meditation is such a simple technique. It doesn't require any gadgets for us. It may be considered as an adjunct to guideline-related cardiovascular risk reduction. In other words, what they're saying is, apart from taking other forms of risk reduction by having a healthy diet or exercise, meditation can be added on to that as well. And there's another one, Sleep Association, where they said meditation appears to be a viable alternative for treatment for chronic insomnia or problems, or people facing problems with sleep. And this could be considered as an alternative treatment for people suffering from these sleep disorders. And again, a lot of other associations like cancer societies and pediatric associations, they're all coming on board in recommending this meditation, the wisdom of the ancient wisdom, or the wisdom that's been known in many cultures. I would like to talk about one other aspect of the technique of heartfulness called cleaning. It's a very unique aspect of heartfulness as well, where the impressions that are laid down over a period of time are being cleared away. This can be done individually or with the help of a trainer. What is being cleared away is the emotional memory and the network that it creates in the subconscious mind. Our subconscious mind is extremely powerful, and it lays down these emotional memories and emotional influences over a period of time. And that's what leads us to create habits. And that's also, and because it is quite powerful, it's very hard for us to break any patterns or habits and form new habits. They in turn, all these emotional memories and all these impressions influence our thoughts, actions, and habits. In order to build new neural connections or form new habits, what we call as neuroplasticity, which Suman also talked about. We need to be able to break down the previous pathways, because the mind being very, in a way of functioning, it being trying to be efficient, it keeps going back to the old pathways. That's why when we take new resolutions or take resolution to break down a habit, it almost always doesn't work, because we have to have a buy-in from the subconscious mind. Also, we have to maintain the newly created pathway, fostering the neuroplasticity. That's where the role of this cleaning comes in. This technique helps to improve those impressions lying deep within us and break down this pathway. So various aspects of this cleaning or various techniques of cleaning exist as well. And, according to specific situations, we can deal with it. So these are all simple, practical techniques which can be done essentially to bring about change within us with minimal effort. That's one more aspect is a simple breathing technique. We do plenty of breathing techniques and asanas. And one particular simple technique which I like to share with people, because some of these things which a lot of my physician colleagues use for people with increased blood pressure or people with stress, is something called the left nostril breathing. It's such a simple technique where we close our right nostril and breathe through our left nostril. What it does is it affects or it positively influences our parasympathetic nervous system or our rest or digest pathway, or improving the vagal tone, which Suman was talking about. Mm-hmm. So when we do this, close the right nostril and then breathe through the left nostril at your own pace for about 10 times, it helps us to calm down the body and mind, and also triggers this vagal tone or the parasympathetic pathway. As a consequence, if you're able to do it a few times, or even in times of stress or in times of anxiety, it helps you immediately to calm down. And the advantages is also that it helps you become, over a period of time, more and more aware of our breathing. And there are other breathing techniques. I was just pointing out one aspect of this breathing technique, which can be extremely beneficial, and it's so simple, actually. It's so practical to use. Mm-hmm. And practically, I've heard so much of enormous benefits from, not just from my colleagues, from people who have used this. Because ultimately, we need some simple but effective practices. Absolutely. And just, that's where the role of these conferences have been great. Mm-hmm. And just to summarize, I just wanted to put them all together and say some of the points which I wanted to summarize, or I talked about this, and we all know the chronic diseases like diabetes or increased blood pressure, they are a huge burden, not just to this, at a personal level for people going through them or suffering this, but affects the families and the countries as a whole. And there are so many of these risks are actually preventable. And we have tried the conventional means, and bringing in the alternative therapies and integrative thinking helps put the focus on certain simple techniques like meditation and yoga, mm-hmm. which has enormous benefits, not just in its intrinsic level, but in the health level as well. They give us practices which support creating these healthy habits and a balanced mind. Now, my teacher often says this: when the world is at peace and the mind is not at ease, it does not really benefit the individual. Mm. When the mind is at peace and the world around is in pieces, that really does not help the world either. If at all, one of the important lessons we have learned from the pandemic is the care of the individual unit is critical. If we don't cooperate or if changes don't come within, it's going to affect everybody else. That applies to these invisible pandemics as well. Chronic disease is one thing we talked about, but there are other invisible pandemics, stress being one of them. And we could also add hatred, prejudices, and greed as well as part of these invisible pandemics.
Right.
Unless these changes are incorporated at the individual level, the larger goals like compassionate communities or bridging social inequalities, they will remain elusive. And that's where the importance of these techniques and incorporate them into our life.
Absolutely. Arvindamji, thank you very much for this perspective. Would love to listen to both of you, but time doesn't permit. But towards the end, you have addressed one aspect. You have given a practical suggestion regarding breathing through the left nostril. But how can conferences, in a minute, if you can sum it up, you have been a participant in this conference and you have seen other speakers also speaking. Dr. Garg has been always talking about integrative approach towards our health, and it's bearing fruits now. Earlier these things were just confined only to the medical field only, but now it's coming up, it's making an impact. So how do you feel these kind of conferences are making an impact? If you could just sum it up with this answer.
Absolutely. Again, we need the awareness.
Mm-hmm.
And these conferences are bringing the awareness. So one thing I would say is awareness. The second thing is acceptance. The experience of a lot of these people, and combined with their own experience from their background, speaks for volumes. And this is not to be discounted and taken into account. So there's awareness, there's more acceptance, and more mainstream. For mainstream to accept and take this up, we need more research, and
Right.
we need to bring about more and more of these research projects. And that's where coming together of these brilliant minds and coming together of like-minded people
Mm-hmm.
helps in taking this forward and create more platforms for research. We are a group of us physicians who are involved in assessing, the corporate burnout
Mm-hmm.
using the heartfulness meditation technique.
Right.
So things like that will go a long way. It'll take us mainstream for acceptance, and rolling out these techniques to healthcare and other areas. Think about the enormous healthcare cost reduction this can bring about.
Very true.
And some of these will have a major impact on the way the countries function and the healthcare functions.
Absolutely. There's no doubt about it. And this awareness and acceptance is increasing, which is a matter of great encouragement that both sides are accepting each other, and it is helping the community at large. Dr. Suman Kollipara and Ravindranji, thank you very much for your time. It was a pleasure listening to you, and we thank you from the bottom of our heart, and the entire team of CINI also thank you for your contribution to this conference. Thank you.
Thank you very much.
Thank you. And we would like to tell our viewers that the Harpreet Singh Show has been collaborating with Dr. Arun Garg from Canada Indian Network Society for the past about 1 year. The second Tuesday of every month, we have some guests who come from around the world and talk about this approach of the integrative approach, that we need to start taking care of our own selves first, and then that is how we can bring about the desired change that we want to see in the world. So from this wisdom, we will be continuing in the next few days also. All the participants who participated in this conference will be coming over here and talking to you directly. And of course, these videos can be seen at the CINS.org, the website of Canada Indian Network Society. Thank you very much for sparing your time, and to our viewers also. And every evening at 7 p.m. Pacific Standard Time, Monday to Friday, I am sharing with you different speakers who come from around the world and talk about different aspects of life as to how we can become better human beings and serve the community and also ourselves. Once again, thank you very much. See you again. Have a safe evening. Stay healthy and enjoy yourself.